My name is Heidi Armstrong. I'm the founder of Canine Athletes Toolbox. I'm trained in canine trigger point massage therapy, and this is my dog Cheza. A trigger point is a hyper-irritable spot in a skeletal muscle, or said another way, it's a sore spot. I suspect trigger points in a dog when I check their joint range of motion and I find that it's limited. So, for example, if I'm checking shoulder range of motion and the shoulder should extend this far in a dog, for example, and it only extends this far, then I suspect trigger points in the opposing or antagonist muscles. And so I work a list of muscles from most frequent location of trigger points to least frequent and release those trigger points by placing a little bit of pressure on them. I may get a response from the dog. So I may see pupils dilate. I may see the dog pick their head up and look at me. I may get a local twitch response in the muscle, or the dog may simply be completely asleep and relaxed on my table. So look for that when I'm working on Cheza in the snippets. Okay, so first we'll check shoulder extension. Okay, so this is good. So she's lacking a good, 15, 20 degrees of shoulder extension. And her shoulder flexion is pretty good, a little bit tight. So when I put my finger on that trigger point, her eyes opened up and got pretty wide. And you can see her looking at me. She's letting me know that's a trigger point and it's a little sore. So you can see that was a clear indication of a trigger point. So I've worked all of her muscles that would limit shoulder extension and shoulder flexion. So let's recheck her range of motion and see what that looks like. So you can see that she had a little bit of a twitch when I was flexing her shoulder. So I'm going to work a couple of muscles again. And this is how the process works. It's check the range of motion, and then work the trigger points and recheck the range of motion. I know that the trigger points have resolved when the range of motion is restored.